The information provided in the Golden Nuggets health and wellness shows, including but not limited to advice, tips, and discussions on mental, physical, and spiritual well-being, is intended for general information purposes only. It is not a substitute for professional advice or treatment. The Golden Nuggets health and wellness shows are designed to inspire and inform, promoting a holistic approach to health for the mind, body, and soul. However, individual circumstances vary, and what works for one person may not be suitable for another. Before making any significant changes to your lifestyle, diet, exercise routine, or adopting new practices discussed on the show, it is strongly recommended that you consult with qualified healthcare professionals, nutritionists, or other relevant experts. They can provide personalized advice based on your specific needs, health status, and any existing medical conditions. The host, guest, and producers of the Golden Nuggets health and wellness shows do not assume responsibility for any consequences arising from the use or misuse of the information provided. Viewers and listeners are encouraged to use their discretion and take responsibility for their own health choices. By engaging with the Golden Nuggets health and wellness shows, you acknowledge that the content is not a substitute for professional advice and that you will seek the guidance of qualified professionals when needed. Thank you for being a part of the health and wellness community.
Welcome to Golden Nuggets Health and Wellness Show, the television program that's redefining self-care for the mind, body, and soul. My name is Dr. Elect Starr. I'm a licensed mental health counselor, health and wellness consultant, and your host for this show. Our mission is simple: to empower you with creative and innovative self-care strategies that will help you prosper, be in good health, even as your soul prospers. In our first series entitled Compassion Fatigue, The Cost of Caring, we dive into the emotional, physical exhaustions experienced by helping professionals. We explore what compassion fatigue is, who's at risk, its signs and symptoms, and most importantly, the steps to address and prevent it. But before we begin, allow me to introduce our distinguished guest. Today we have with us Indya Peoples Simpson, and we have Dr. Anthony Walton. These are mental health folks. So I'm excited to have you. Thank you for joining us.
Thank you for having us.
So I'd like for you both to just tell us a little bit about you before we begin our discussion on compassion fatigue. We'll start with you, Indya.
All right, well, like you introduced me, my name is Indya Peoples Simpson, and I have a group practice called Healing and Hope Restored, and that keeps me very, very busy. Also, I work with 2 companies that I provide clinical supervision. So this topic is very important, for sure.
Awesome. Dr. Walton,
Yes,
tell us about you, sir.
First of all, I say I'm honored to be on your program, Dr. Starr.
Very well.
I am deal with marriage and family therapist. Also, what I focus on is the family dynamics. I deal with relationship therapy. I do counseling. I do group therapy. I do relationship seminars as well as grief and loss, because there's a lot of that when you're dealing with family components. There's a lot of grief and loss. It affects the whole dynamic of family. So that's what I've kind of found myself drawn to here lately. So I enjoy working with people. I enjoy all diverse groups. I don't think there's a group that I don't like working with, but most of them I enjoy. There's some I enjoy working with more than others, but I certainly enjoy working with different clients.
Well, we appreciate both of you and the work that you're doing. I'm just honored to have you today.
Thank you.
So before we ask you questions about how you've experienced compassion fatigue, I'd like to just share a little bit of information to our audience who may not be familiar with that term. So I just want to begin by just defining what compassion fatigue is. So it's a gradual lessening of compassion. If you can imagine losing that compassion for others and for yourself as well. And it happens over a period of time. It's this profound emotional and psychological exhaustion and that caregivers, those in the helping profession, experience as they support individuals who are suffering from mental health issues, sickness, disease, oppression. Think in terms of people in the helping profession who help folks who are hurting. Compassion fatigue can have a very devastating impact on individuals. So there's this decrease in productivity and absenteeism, inability to focus, and then there is this development of new feelings of incompetency and self-doubt. So fatigue, is a very serious issue here. And so I'm so honored that you're here to tell us how you have experienced compassion fatigue. We'll start with you, Indya. Just share your personal experiences about when you experienced compassion fatigue in your work and how you recognized it.
Well, ironically, it took me a minute to recognize it. I will tell you, as you were talking about those risk factors, the just being emotionally and physically exhausted, and I think because of all of the work that I do, the exhaustion was just, I just kind of put it off on that. I'm just exhausted because I have a large caseload. But it wasn't until the apathy set in. And then you even mentioned it too, that self-efficacy. I started to really have a lot of self-doubt and feelings of inadequacy. And that's when I knew, like, wait a minute. I talk to people about compassion fatigue and this vicarious trauma all the time, and I'm experiencing it. So I think that it was then that I knew I needed to do something different.
Wow, it's real, isn't it?
Oh, yes.
Dr. Walton, share with us.
Oh, yeah, I'm pretty familiar with fatigue. What has happened, I think, is not just one factor, it's a number of factors. And when all those factors merge together, I think it's the challenges in our professions that you have to be sensitive to individuals,
For sure.
but you hear so much of it. And so you don't want to become desensitized, but you have to be sensitive. But if you allow it to get to you too much, then you become emotionally involved.
So can you share with us how you have experienced it personally? Yes.
It happened to me when I was going through a lot of different things. I was dealing with my clients. Also, I pastor as well, so I was dealing with pastor ministering, and I had a relative that was sick that was in the hospital. So I'm dealing with the clients, I'm dealing with all these, I'm wearing all these different hats. And all of a sudden I notice I'm getting tired, I'm getting stressed out, I'm getting frustrated. And so I realized that, hey, I need to check in on myself. I had to check in myself and realize, hey, are you being as effective as you can be? Are you overloading yourself? And so what I had to do is I had to start unpacking things and start unloading things.
Wow, thank you for sharing. So perhaps our audience is not aware of who's at risk. So I'd like to identify those individuals who are at risk of compassion fatigue. So we have those in the helping field who are profoundly affected by the work that they do. And I remember reading something and it said, the greater your compassion level, the greater the risk of compassion fatigue. So if you have this huge heart for caring, supporting, then you have a huge risk, can we say,
For sure.
of being impacted by compassion fatigue. So we're looking at people who have experience with direct exposure, and those would be firefighters, paramedics, police officers who are at risk of compassion fatigue.
True.
And then you have those who are experiencing secondary trauma. They're not directly involved, but they are supporting individuals who have been involved. So you have mental health therapists such as yourself.
Yes.
We have social workers, we have nurses, caregivers, clergy's wives, and even parents and foster parents who are caring for children, right?
Yes.
Who have experienced trauma, or even the loss of a loved one. So these are the individuals who are at risk. So my question for you is, what advice would you give to aspiring mental health counselors to help them better understand and cope with the potential challenges of compassion fatigue. And let's start with you, Dr. Walton, this time.
You know, I would tell them you have to know yourself and know your limitations. Sometimes we don't realize our limitations. We want to solve everything, want to help everybody, but you can't help everybody.
Excellent.
You can't do everything. So you just need to know your limitations and have balance in your life.
Wow, that is excellent. That's a mouthful right there. Thank you. Indya.
I would say be really conscientious about not only the size of your caseload, but the types of your caseload. And one really quick example, I started to notice that I had a lot of people who were depressed. And so that was really starting to affect me. So I had to mix it up. So just keep an eye on that. And I think it's really important to have an adequate social network. That's
Absolutely.
huge. That's huge.
Yeah, I was thinking when we were in school, did we have a course on compassion fatigue?
I didn't.
I didn't know.
That might be a suggestion
Could be.
to incorporate that because you get out here and you're excited, right? And you're ready to do the work and help everybody.
World.
And I'm thinking, as a matter of fact, Dr. Walton, was there a course on setting boundaries?
No, there's never a course.
Oh my
setting boundaries.
goodness. Oh my goodness.
Yeah.
Isn't that interesting?
Yeah.
And those are two important things, isn't it?
So true.
Setting healthy boundaries in this work. Well, I would like to just mention some of the signs and symptoms. Again, because there are people that aren't familiar, right? With this phenomenon, I call it. So we mentioned exhaustion. So it's not just physical, it's mental.
Yeah.
It's emotional. Just a draining effect. Decrease in empathy. It's hard to imagine that you would have less empathy for yourself and others, but that's a reality.
Right.
True.
And then there's these impulsive thoughts and images. Have you ever woke up in the middle of the night and your client was on your mind?
Yep.
Yeah, it's not like you really want to think about it.
Right.
You've already spent, 50 minutes or an hour, and then there you are in the middle of the night,
Right.
and you can't get this image out of your head. So it's real. Increased irritability, sleep disturbances, as I mentioned, physical symptoms as well, and then reduced satisfaction in your work and personal life. Do you have anything to add to any of those signs and symptoms that a therapist can experience?
I think you covered them quite well. You know, any change from your normal behavior should be an indication that something's going wrong.
Excellent. Do you have any other signs or symptoms that you can think of,
Just
Indya?
that, burnout is very different than compassion fatigue. Burnout is just job dissatisfaction, but compassion fatigue is so much more. But if you do take care of yourself, you can get through it. The recovery is much shorter.
I'm glad you mentioned that. And being a supervisor, by the way, I'm sure you have had these conversations with your folks that you work with.
Yes, trying to give them what I didn't get. So I do talk a lot about compassion fatigue and risk factors, and I'm always checking in and helping them to understand what their risk is.
That is awesome. And what about you, Dr. Walton? Any experience with folks that you're working with, colleagues, regarding compassion fatigue or any of these symptoms? Have you had any discussion among your peers?
You know, I have had individuals tell me who they've experienced it, but I like what Indya was saying, how that she's given to those others what she did not receive. And I wonder, as you said earlier, why isn't that the professors and everyone didn't instill in us, because they had that experience at some time too.
Right.
So I think it's important that we can say that I'm willing to share with someone else so they won't have to experience exact things that we did.
Sure.
Yes, that is excellent. Well, we're going to pause for a break, but when we return, we're going to come back and talk about what are the steps to address and prevent it. We don't want to just talk about the problem, right? We want solutions.
For sure.
And so thank you for this time of sharing. Your information is so rich, and I'm looking forward to what we have to say, what you have to say about ways to prevent it. And we'll be right back. We're going to pause for now. Thank you.
Thank you.
Feeling Anxious? Perhaps you're dealing with a past trauma and don't know where to turn for help. Turn to Unlimited Possibilities. We provide a safe and caring space for individuals and families to help improve the quality of their lives. Whether you need help with spiritual matters, trauma, depression, and more, Unlimited Possibilities can help you overcome your situation with compassion, acceptance, respect, and empowerment. Unlimited Possibilities, where all things are possible if you believe. Call or visit our website today. Dr. Starr, best-selling author of Golden Nuggets, Food for the Mind, Body, and Soul, is also a health and wellness speaker and consultant who provides motivational speaking, training conferences, and one-on-one coaching to improve the quality of life. She's passionate about helping people heal from the inside out. Dr. Starr provides creative and innovative self-care strategies that empower you to prosper and be in good health, even as your soul prospers. Call or visit the Golden Nuggets website today.
Welcome back. We have been so excited to have our guests today with us talking about compassion fatigue. We've defined it, we've talked about the risks, signs and symptoms, and now we're going to talk about the steps to address and prevent compassion fatigue. So this is what we've all been waiting for. How can we solve this problem? So I'm going to just share a little bit about what it takes to prevent compassion fatigue. It's essential for individuals and in caregiving and helping professionals to recognize the signs and symptoms. That is so important, recognizing the signs and symptoms. So what can we do to prevent it? Once we know those signs and symptoms that we talked about earlier, how do we minimize those signs and symptoms? First thing, a self-care plan. A self-care plan is essential. And so I want to ask my guests today what they think about a self-care plan, why they think a self-care plan is necessary to minimize the risk of compassion fatigue. Indya, let's begin with you.
Well, the self-care plan is really pivotal because that's how you rejuvenate. That's, at least for me, that's how I rejuvenate. And I will say, when you were talking earlier about what class they had for compassion fatigue, no, there wasn't one at IUPUI where I went, but they did talk a lot about self-care, but not really how to make that happen.
Right.
Interesting.
And so, I mean, it can look a number of different ways. I call it my compassion resilience.
I like
How
I like
I'm
that.
compassion resilient is just making sure that I am checking in with people who really care about me, incorporating things that fulfill me in my life. I mean, the work that we do is so important. We're not the
Absolutely.
sole, our work is not our sole identity.
True.
And so just remembering that and incorporating fulfilling and fun interests is part of my self-care plan for sure.
And I happen to know one of the things you enjoy doing is traveling.
I do.
Yes.
I really do. And you know, again, part of that self-care plan, it doesn't. I've learned that it doesn't have to be the Caribbean, though I prefer it.
Of course.
I could be in Ohio, and what I've learned is that as long as I'm away from my house, my computer, my daytimer, my, all of my office stuff, as long as I'm away from there, I'm able to rejuvenate. I'm able to check out. I'm able to diffuse from my work hat,
Yes.
and really just be more present in what, whatever, mindful in whatever I'm doing in the moment.
That's beautiful. I would like to ask you, though, this question. Have you ever gone away and ran into a counseling moment and you were trying to get away from it and you run smack into it and there's somebody
Yes.
in the Caribbean that needs therapy?
Yes.
How do you handle that?
Or
we talked about setting boundaries.
Or we'll be talking and they'll be like, oh, I'm an investment banker. So what do you do? Oh, well, I'm a therapist. Physical therapist? No, psychotherapist. Oh, I really had a hard time with blah, blah, blah. So yes, that kind of thing comes up quite a bit. And I will say that I am drawn in initially just because it is second nature what we do. But it doesn't take me long to be like, you know what, I gotta go.
Sure, it can happen to us.
Yes.
Dr. Walton, this creating a self-care plan, tell us a little bit how you incorporate the plan in your life to prevent compassion fatigue.
Okay. Like I said, I have learned to set boundaries. Even I have the dual role of a therapist and a pastor, and so I tell people at the church now, after 10 o'clock, don't call me unless it's emergency. After 10 o'clock, if it's emergency, leave a text or voicemail, I'll immediately respond. But I had some people call me at 9:59. Now, that's something I don't know about that. But they'll call me 9:59. So I set those boundaries, but I always make sure I set time for myself, set time for my family. I've been married 42 years, and every Friday is our date night. Because sometimes we find out that our families are close, those close to us, get neglected. So I realized that that's important part of my therapy, no matter where I'm at. And I'm like Sister India, I like travel.
Yes.
I think in the last 7 months, I've probably been 8 different states in the last 7 months.
8?
Traveling. And,
Wow.
And could have been to a few more. And so it's learning to enjoy life,
Yes.
learning to focus on the positive and not the negatives. And I think when you are drawn to this profession, there's a natural proclivity that we have to love people and to empathize, and people can relate to us. And it's almost like I have therapists where I can go anywhere. I don't care where. And all of a sudden, this is before I was a therapist. People just start asking me.
tell you
know,
everything.
they'll sit down. A waitress, a waiter will just sit down at the table and start asking me. You know what? I'm going through such and such. They said, I don't know why I'm telling this right here. I'm saying, well, thank you very much. But I think it's something that comes natural with us, and so you have to limit yourself, and you have to address it, but you don't want to go into full therapeutic mode.
For sure.
Just give them a little golden nugget and
like
keep
that.
it
I
moving.
like that.
I like that. One of the other things that's recommended in order to address and prevent it is seeking support and counseling. So I have people that ask me, so do you get counseling? They want to know, does the therapist have a therapist? So what do you think? I think it's important to seek support, whatever that looks like, and to have counseling, whatever that looks like. But what does support and counseling look like for you, India?
It does look like having a therapist, and I'm a big person that believes that every good therapist should have a therapist, because we do need to be able to unload. I kind of jokingly say to people, I paid my hard-earned money to get training to be an emotional trash dump. Everybody, I'm seeing people sometimes on the very worst day of their life.
Right.
And I'm taking that, like they're leaving that in my office. And I'm taking that into my home, into my church, into, into my car. Everywhere I go, I'm taking these things with me. And so I need a place where I can unload this stuff, which is why the Caribbean is where I leave it at sea. But I do have a therapist, and I think that it's important to have a place where I can unload and say some of the things that are really traumatizing to me.
And just out of curiosity, for our viewers' sake, why not just have a best friend? A buddy.
I
Go out to lunch, have coffee,
have a best
chit-chat.
friend, and there's a story there. I do have a best friend, and quite frankly, if I didn't have a therapist that I paid, my best friend is a marriage and family therapist, and so she is somebody that I can go to really quickly when I, am frustrated, or when I am perplexed, and things like that. But I do think that it's important, because this person, their hat is therapy. Their hat is, just like me, they come into the room with their shoulders ready to take what I present. And so that's why my best friend is good for some things, but I think it's important to have somebody who won't just tell me, well, girl, if I were you, I need somebody who's going to clinically help me.
Sounds good. Dr. Walton, what do you think about seeking support and counseling, and how do you incorporate that into your lifestyle as a family marriage counselor?
All right. I believe in integrating the therapy with the spiritual aspect of integrating the both. And so one of the things that keeps me in balance is knowing that I'm only limited. I can only do so much. What I can't do, I put in the hands of God. Also, I'm fortunate to have a lot of different friends. So I have different friends. I have one group of friends I can talk about anything. This person I can talk about. So, because everybody, you're different type of
Can't
friends.
handle everything.
So each
Absolutely.
person I can talk to them about different
Right.
things. But that's the exact same thing in ministry. I had a pastor call me out of state just last week. Has about 2,000 or 3,000 member church, and he just said, hey, I just need someone to talk to. So I think it's important. Pastors a lot of times, don't get that care. Mainly, they're the main ones who need it, but they don't get the care. So who they turn to. So I think we need to know our limitations. If I need help, as we tell people they can come to us, we need to have the same ability to be able to go to somebody else and say, hey, I need some help. If you expect people to come to you, why can't you go to somebody else? And
So you
I
were
think
saying this pastor came to
he came to me.
you.
Mm-hmm.
Where do you go?
Oh, I go to, I don't have a therapist, but I might get one therapist though, anybody looking for a client. But no, but I normally, like I said, have friends that I talk to, have pastors who we talk
Okay.
to and we share different things with right now. But
So
I have no
I
problem
agree with
it.
India that we need to be able to decompress,
Mm-hmm.
be able to vent, release the pent-up tension,
Right.
the energy that we're absorbing.
For sure.
It needs to be released. And there are different
Right.
ways to do it, absolutely.
That's true.
So the last one, last step, is setting boundaries. And we've already been talking about that, right? To ensure one's well-being while continuing to help others in the community. I find that some people have a challenge saying no. They'll say, I don't want to hurt their feelings. Or, well, everybody looks up to me. Those are some of the common ones. I don't want to hurt feelings. Everybody looks to me. Everybody depends on me. I'm always there. You've heard those things too? Mm-hmm. So tell us what setting boundaries looks like for you guys, and be as specific as you can to help our audience understand, because believe it or not everybody understands boundaries.
Yeah. I tell my clients
A little time left.
quite a bit that no is a complete sentence. Just like in some of them that are spiritual, I'll say, just like when you're in the car and something happens, you say, Jesus. That's a complete sentence. So is no.
Okay.
And so I do not have that problem. And
Good
I don't
for
know if
you.
it's because I'm older now and I'm just very no nonsense. But no is a complete sentence, and I'm always reminding people of that. And I do hear what you say. I don't want to be I don't want people to think that I'm being mean to them. People are going to think whatever they want to think anyway, no matter what you do. It's so important just to take care of you. It's so important to make sure that, I use an acronym, THINK. If what you do and say is thoughtful, honest, important, necessary, and kind, and the person is still angry, the problem's not you, it's them.
Excellent. We got less than a minute. We got 50 minutes. Quick. What's your thought?
I just agree with what India said. You just have to kind of understand that you're only one person. And I'm just here recently learning, so I'm kind of learning to set these boundaries, telling people, okay, well, it's nice talking to you, because people carry a long conversation with you, say, thank you for your time. And I'm learning to.
Sounds good to me. Wow, you guys have brought a wealth of information, and I know the audience has enjoyed it, our viewing audience. I certainly have, and I thank you for being a part of this program. And I'm looking forward to you coming back.
Thank you for having us.
I want you to come back, and let's continue
Love
to
to.
explore this and
All
flesh
right.
this out, because I believe there are therapists also who can benefit from your information. So thank you for joining us today, and we look forward to seeing you soon.